Hello my friend, I welcome you for today's video lesson. We are talking about a paratubal or a paraovarian cystic mass. You have done the ultrasound scan and the results are showing that you have what we call a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? Your doctor has told you that you have a mass, you have a cyst between your ovaries and between your fallopian tubes. In this video, we are going to discuss all this. We shall also give you some pregnancy tips and how you can get pregnant faster. Naturally. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend, and if it's your first time, remember to subscribe so that you do not miss videos we release every day about fertility and reproductive health. On this channel, we create awareness about fertility and reproductive health. We are talking about a tubal ovarian cystic mass. What is a tubal ovarian cystic mass? When we look at the name, tubal ovarian cystic mass, tubal means your fallopian tubes, and then ovarian specifically comes from the word your ovary. So a tubal ovarian cystic mass is a mass which is between your ovaries and your tubes. But specifically, there are three major types of masses or swellings which are found in the reproductive system of women. The first is what we call a myoma, which is a mass filled with muscular tissue. Myo means muscle. And then we have also masses known as fibroids. And fibroids are specifically swellings or masses which are filled with fibrous tissue, and that's why we get the word fibroid from the word fibrous. But in this video today, we are talking about a tubal ovarian cystic mass. How does it appear? How does your doctor know that this is a tubal ovarian cystic mass? When we take a closer look at your ovaries, as you can see in this picture here, the ovary is specifically that organ which is responsible for producing the eggs or releasing your eggs on every 14th day of the month during a process known as ovulation. So, what if you have your ovaries? They are normal, they are having the follicles or they are releasing the eggs. You are seeing your periods every month. But at the end of it all of a sudden, you begin feeling sharp pain in your side, either on the left side or on the right side. Then it is high time, my friend, you go to hospital and have some checkups done. The checkups we are talking about include a pelvic ultrasound scan. Mu video eno leero tuli kwogera ku ebizimba, twogera ku bizimba, tuli kwogera ku bizimba bye bayita tubal ovarian cystic mass. This video is going to be in Luganda and in English. So, we tuba twogera ku bizimba tawanya abakyala, ojja kulaba nti ebizimba bino bya mirundi esatu. Waliwo ekizimba ekisooka kye bayita fibroid, ekizimba ekyokubiri kye kino kye bayita myoma, then ekizimba ekyokusatu kye kino kye bayita cyst. We are talking about these three types of, we are talking about the cysts, and we are saying that the tubal ovarian cystic mass specifically can be identified on ultrasound scan, and we have said that when you take a closer look at how a cyst appears, normally it has a thin wall, and then it is also filled with free fluid, or it is filled with fluid, and it is actually, when you look at it on ultrasound, when you take a closer look at the ultrasound image, it's normally very black. Tuli kwogera ku bizimba era tuligamba nti ekizimba kye bayita cyst oba tubal ovarian cystic mass. Ekizimba ekyo kisangibwa between oba kisangibwa mu makati ga ejjiryo lye bayita ovary n'enseke ze bayita fallopian tubes. Era tugambye nti kino ekizimba oba ng'okyetegereza ku kafaananyi ako akabeera ku kifaananyi kya ultrasound oba ku bbaluwa ye eya scan oba ka TV, oba otunudde kafaananyi ako akabeerako ojja kulaba nti ekizimba ekyo kiba kya black, kibeeramu kwegamba kiba kya round naye ate kibeeramu ebintu ebya black. Ebintu ebya black ebyo ge mazzi oba ge tuyita free fluid. Let me know if you have any questions down below in the comments. Below this video, I will answer all your questions. Gerard Massa, the health educator, is the name of the channel, and we are talking about the tubal ovarian cystic masses. How can you manage these tubal ovarian cystic masses? Ojjanjaba otya ebizimba bino katugeze oba ozuuliddwa nti olina ekizimba kye bayita cyst. The treatment of tubal ovarian cystic masses specifically begins with doing some tests, doing some investigations. Okujjanjaba okw'ebizimba kirungi nnyo n'oba nga at least doctor wo asooka n'akola ku tests okuzuula ebizimba bino byajja bitya. Most of these tubal ovarian cystic masses, or most of these cystic masses which attack the ovaries or which grow in the ovaries specifically, they tend to resolve by themselves. They can disintegrate. Those which can disintegrate or disappear on their own, even without treatment, are known as the corpus luteal cysts. Ebizimba bino byo byennyini bisobola okuba nga bibula ate n'oba tofunye bujjanjabi. Katugeze bino ebizimba bye bayita corpus luteal cysts bisobola okuba nga byo byennyini bibula. So oba nga obadde okebeddwa ne ebbaluwa yo n'eraga nti olina ekizimba kye bayita the corpus luteum cyst oba corpus luteal cyst, then oba tolina kweraliikirira biba bigenda kuba bibula. N'oba olina olubuto era olubuto lusobola okukula obulungi naye ng'ate akazimba ako ne kaba nga kasaanuuka ne kaba nga kasaanaawo kokka. What if you have the tubal ovarian cystic mass and it does not disappear on its own, it does not disintegrate? Then you need to do some more tests you need to do a laboratory test for your hormones. You need to look at how your follicle stimulating hormone is, how your estrogen levels are, and then also you need to do what we call the AMH test or the anti-Mullerian hormone levels. We've talked about the anti-Mullerian hormone levels. If you missed that video, after this video, please kindly check in our video library. There's a video on the anti-Mullerian hormone. Tugambye nti obanga ozuuliddwa nti obadde olina kino ekizimba naye ate ne kiba nga tekisobodde kubanga kibula kyokka, then olina okumakinga sure nti okola test eya hormones oba kye bayita the anti-Mullerian hormone level test and the follicle stimulating hormone test oba FSH test. Test zino eza hormone ziba zituyambako okulaba kyandibanga ebizimba bino biri kujja olw'okubanga hormones zo zibadde tezibalansinga. Remember, for these cysts to grow, you actually have to realize the fact that these cysts actually can grow from some specific areas, for example, where the Mullerian ducts are, oba ebitundu ebivaamu oluseke lwe bayita the Mullerian ducts. So when you do the AMH level test or when you check your anti-Mullerian hormonal levels and you discover that it is actually higher than 4, because the normal is supposed to be 1 up to 4. If your results of the anti-Mullerian hormone levels come out and they are higher than 4, then it means you are at high risk of developing a condition known as polycystic ovarian disease. It could be that you are having a single tubal ovarian cystic mass, but when your AMH levels are high, then there are high chances that you could develop that. And specifically, there are medications which will be prescribed to you by your doctor to stabilize your hormones. Obanga obadde ozuuliddwa nti obadde olina results zino ate nga ziraze nti hormones zo tezibalansinga oba okoze test ya AMH results nezifuluma ne doctor wo nakugamba nti results eza AMH ziri waggulu nnyo, then eddagala weeri erisobola okuba nga likuweebwa ate n'obanga hormones zo zistabilizinga bino ebizimba ne biba nga bisaanuuka oba nga bisaanawo byokka. Paratubal ovarian masses or tubal ovarian cystic masses normally can resolve with medication, but if at all they do not resolve and they are higher, they are actually around 100 millimeters and above, or they are so big in size, then your doctor or your specialist can opt for surgery. where they will be removed in theatre. Ebizimba bino bibanga bibadde byeyongedde okubanga binene nnyo ate biri kuleetera obulumi nga bungi nnyo, then dokita wo asobola okusalawo n'abanga akutwala mu theatre ne babanga bakuoperatinga ne babijjamu ebizimbe ebyo. Kitwale nti g'amazima gennyini osobola okuba nga otereera, naye the most important thing olina okumakinga sure nti okola test oba olina okuba nga okola scan. I thank you, my friend, for attending today's video lesson. I hope you've picked something about tubal ovarian cystic masses. We have said that these tubal ovarian cystic masses normally are those masses which are filled with fluid, but still they grow between your ovaries and your tubes. They could actually even be localized next to your ovary. The most important way to note these ovaries, to note these cysts is by doing a pelvic ultrasound scan, which will confirm presence of these masses, and then also measurement will be taken. Tests on your hormones, for example, the test for FSH and AMH can be taken. If the levels show that you are having high FSH levels, then there are specific drugs which may be given. Your doctor or your specialist will be the one to decide. Do not self-medicate. This video is basically for information purposes to make you aware of how your system is. We create awareness about fertility and reproductive health. But my friend, one thing you have to note is that you can get treatment and you can get better even if you have been told that you have the tubal ovarian cystic masses. You can be treated. There are specific drugs, for example, the gonadotropins, which will be prescribed to you by your doctor. And yes, when you take these according to your doctor's instruction, you can actually get rid of these cysts, and then also you can get pregnant. Remember, these cysts do not prevent you from getting pregnant. The only issue is that please have yourself checked before you go ahead and get pregnant. Just have a routine pelvic ultrasound scan. You'll be able to see how your system is before you conceive. I welcome you to our channel. Remember to subscribe for new videos we release every day. Nkusanyuse nnyo mukwano gwange okuwuliza ku channel yaffe, era ndowooza olina ky'oyizeemu mu video yaffe ya leero. Tubadde twogera ku bizimba bye bayita paratubal, paraovarian cystic masses oba tubal ovarian cystic masses. Tugambye nti ebizimba bino bitera nnyo okujja byoka nga obadde olina issues oba hormones tezibalansinga, era ne tugamba nti obanga ozuuliddwa nti obadde olina obuzibu buno osobola okufuna treatment n'oba bulungi nnyo. Bwebanga binene nnyo basobola okutwala mu theatre ne bakooperatinga n'oba nga osobola okufuna olubuto. Subscribinga obeere ng'olaba video zaffe buli kanaku. Omukama tukuume. Bye bye. May God bless us all. Have yourself a fantastic and healthy day. Bye bye. I have been trying to get pregnant for 2 months, but I always get my period every month, and I don't know what problem I have. Indeed, today's video we are going to answer a question by one of our subscribers who asked and said that she has been trying to get pregnant for 2 months, but she always gets her periods and she does not know what could be happening. She does not know what could be causing this to happen. Gerard Massa, the health educator, is the name of the channel. This is the fertility show where we do talk about fertility. After this short break, we are going to talk about all this. Hello my friend, welcome for today's lesson. This is Gerard Massa, the health educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerard Massa, the health educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you. So we are proceeding with today's lesson. We are talking about one of our subscribers has asked a question, and the question is, she has been trying to get pregnant, but she keeps seeing her periods every month. She has been trying to get pregnant, but she keeps seeing her periods every month. The first step we shall talk about is, whenever you are trying to get pregnant, there are 3 things which need to be put into consideration. You should understand your menstrual cycle. You should also understand that the menstrual cycle has 2 phases. We have the follicular phase, and then also we do have the luteal phase.